Okay, welcome. Now I want to discuss about what is shock. For individuals who are in the medical community, shock is a very common encounter that we get daily in our practice, especially those who are practicing in emergency medicine as well as in wards in intensive care units. You get a lot of cases with different types of shock. So, how you define shock? Shock is defined as inadequate tissue perfusion, which results in cellular or organ dysfunction due to inadequate supply of oxygen and nutrient to the tissues. So finally, that results in cellular and organ dysfunction, and if left untreated, that will result in death. Finally, that may result in death. So that is how you define shock. That's how you define shock. So how you classify shock? How you classify shock? Let's see the classification. So we have generally four major categories of shock. The first category, and in fact the most common type of shock, is hypovolemic shock. Hypovolemic shock, which is most common and prevalent type of shock. The second type of shock is cardiogenic shock. Cardiogenic shock, which occurs in individuals with certain cardiovascular problems. And the third shock type is obstructive shock. Obstructive shock due to certain obstructions to the blood flow into the heart. So obstructive shock in patients with like pneumothorax, patients with like cardiac tamponade, they may develop obstructive type of shock. The other important type of shock you should know is distributive shock. Distributive shock has also a lot of classifications under it. I will discuss the especially distributive shock, the types like septic shock, anaphylactic shock, and also the neurogenic shock as well. Neurogenic shock are classified under distributive shock. So there are certain features that make distributive shock that they have in common. So, for example, peripheral vascular dilation is one of the commonest feature that all types of distributive shocks can have together. So this is how you classify shock. So in my next presentation, you will see what shock management is, and for the diagnosis of shock, we do have series criteria of shock diagnosis. We do have SOFA criteria of shock diagnosis. The newest one, which is the SOFA criteria, we'll discuss what is SOFA criteria, and we'll see the previously we were using, which is the series criteria of shock diagnosis. So uh, it is recommended. It's recommended everyone in a medical community should know well how to diagnose shock, and should define it well, and should know the stepwise management of shock, because in shock, time is very important. The time you take measure can save the life of your patient, or with a delay of certain minutes, you may kill your patient. So taking immediate measures and having uh, timely decision is very important for saving your patients. So I will present in this channel about shock with a series of videos. For now, thank you. My presentation was on the definition of shock and the classifications of shock. So in the next videos, we can discuss about the pathophysiologic mechanisms of shock and the diagnosis of shock, the management approaches for each types of shock, because we already discussed the four major types of shock, and the management scenarios also different for such different types of shock. Thank you very much. I love you all.